Have to okay that. Testing. Hi, everyone. It is DocTalk. It is September the 12th. And September the 12th, a very important day. Yesterday, the anniversary of the 9/11 attacks. A wonderful day for us to remember. Our freedom isn't free, and a lot of people are at risk every day taking care of us. Please remember your first responders. Please remember fire service, EMS, police, our military, all of the other security people who influence our lives. A big story yesterday was about how the TSA came to be after the FAA had to make some really big decisions, pulling planes out of the sky on 9/11, and how they believe that saved lives. And we are really blessed to have all these people thinking through ahead of us what bad people want to do to our country and to the people who live here. And God bless all of you who participate in making our lives safe and making our country free. And yesterday was the community's opportunity to talk to their first responders and public safety people at a variety of ceremonies, which we had here in our community. And it's really incredible what people do. So thank you. Today, a very important topic: the CDC released yesterday recommendations for the COVID vaccine for the fall. We have three choices of vaccines now: Novant, and Moderna, and Pfizer. The protections against COVID have waned for many of us. And it's really, at this point, going to be between 8 and 12 months when the ideal period is for you to get vaccinated at this point in how COVID is changing itself. They have released in the last 2 weeks the latest version of the COVID vaccination, which protects against the newest variants of COVID. We have had a lot of COVID in the community over the past couple months, really across the nation. And family members have had COVID over the last couple weeks. And so this is an ongoing reminder that COVID has not decided to go away from us, not decided to be very quiet, instead, still making people sick. When you get COVID, it is still a risk, particularly if you're immune compromised. And there's still a risk of getting long COVID. And long COVID gives you that brain fog and muscle aches and inability to function the way that you'd like to function. So, vaccination is good for people who've never received vaccinations. Those particularly at risk are age 65 and over, those who live in long term care facilities, those who are going to get or are pregnant, and for anybody who really doesn't want the risk of getting long COVID. The vaccines currently are for 6 months and older and have no other really significant exclusions. So consider that COVID vaccination. A topic from the reader's bag, so to speak, for these weeks. We've had a lot of illnesses start up with the kids going to school, and we talked about respiratory illnesses the last time. I want to talk about GI illnesses, and this is gross. This is gross, but the poor kids going back to school, and one of the questions is, how do you differentiate food poisoning from illness when you have a child or an adult who is having GI discomfort? So let's talk a little bit about this. So your GI tract, remember, is more than 22 feet long. It has upper portions and lower portions. And those upper portions are designed to process food as we take it in, and to make it into digestible pieces. And then it needs to run through our colon, both our small intestine and our large intestine, in order to pull off the things that we need to sustain our lives. That pull off is a long tube, and it's lined with really important enzymes. And we've talked about before bacteria, and other important little filaments that pull off the most important pieces of what we need for good health. Those pieces, when they get irritated, they have a tendency to release fluids and to force the movement through at a quicker rate. If that's in the upper GI system, so in the stomach in particular, if something is irritating the stomach, then it says, I want to get rid of this. And the way it gets rid of it in the upper part of the GI tract is you vomit. If it's in the lower part of the GI tract, then it is diarrhea. So realize both of those are protective mechanisms. Your body saying it doesn't like something and wants to get rid of it quickly. Illnesses that are caused by viruses, and we use a virus like norovirus or the cruise ship virus as an example, irritates your entire GI tract. You catch noroviruses from other people, they very quickly pass through your GI tract and they irritate both the upper parts and the lower parts, which gives you the traditional presentation of a norovirus illness, which is vomiting and diarrhea. That infamous time when you don't know which end to put down. And oftentimes they're sitting on the toilet at the same time you're holding the trash can and vomiting and having diarrhea at the same time. That, along with fever and muscle aches and a relatively short course before your GI tract says, okay, I'm ready to accept some stuff. That's classic of an illness and a virus like the norovirus. Food poisoning has kind of two versions of it. One of them is when the food already has toxins in it, usually from bacteria, and those toxins are really irritating to your stomach, and your stomach says immediately, "I want to get rid of these." And that version of food poisoning is when toxins are in the food. Your stomach realizes it and you vomit. So that happens relatively shortly within a period of hours after you have eaten food that isn't good. At this time of the year, that's oftentimes around picnics, outdoor events of other kinds, and around food that hasn't been prepared well in even indoor situations. The other form of food poisoning is that where the bacteria and or some other toxins are contained within the food. It goes through your stomach, it gets into your lower GI tract, which is in your intestine, and it begins the process of irritating that. With that comes diarrhea. With that sometimes comes that bacteria planting onto the walls of your GI tract. And in doing that, it's producing more toxin, it's irritating it more, so more fluids. And this is the period of time where you are having continuous diarrhea. It gets more and more watery, it gets more and more stinky. And you're like, oh, this is uncomfortable. That oftentimes is not associated with upper GI, so you're able to drink okay. You're typically, because your GI tract is irritated in some way, you lose your appetite, but you're still able to drink. And drinking at that point means taking in fluids that have some sugar and some salts in them. Um, but in general, anything you're going to run through your GI tract, through your intestine at that point, is going to continue to come out. And oftentimes it comes out in that real watery, loose material. And that is a more significant form of food poisoning. The worst forms of food poisoning have names like E. coli or listeria. And listeria is one which has been famous recently because a big meat producer in the country has had contamination of its meat products with listeria. Those infections, the bacteria that get into your GI tract, so this is listeria, E. coli, and a couple of other names like salmonella, those begin to get into the walls of the GI tract and produce ongoing problems. And in the worst cases, it begins to break down the walls of your GI tract. And then you have blood that gets mixed into the diarrhea. So, those are the most significant forms of food poisoning, and why listeria or an E. coli infection or salmonella are very dangerous to people, particularly people who are at risk for infections. So the usual course of GI illnesses, if you get food poisoned with toxins, you vomit right away within a period of, let's say, a couple of hours. your stomach has settled itself down, you don't have associated diarrhea, you don't have a fever. This hasn't irritated the rest of your body so that you produce a fever. And you're like, that wasn't pleasant at all, but I'm starting to feel better. And at that point, you can begin to slowly introduce simple liquids and solids into your stomach and give it a chance to settle down a little bit. But generally, starchy foods, simple foods, and fluids, along with some electrolytes and some sugars, will get you back on your feet relatively quickly. For food poisonings that relate to our usual day to day stuff, they irritate your colon, they produce some diarrhea, they do not produce blood. You get over that within a period of 12 to 24 hours, and you're back on your feet again. Typically, with those, you lose your appetite for a short period of time, but don't vomit with them. The more serious infections are those where there is a lot of diarrhea, it's lasting for longer than 24 hours, and in the worst cases, produces blood in your stools. Let's talk about that gross subject for just a minute here. Blood in the GI tract has a couple different for different flavors and very honestly smells to it. If you're bleeding in the stomach or in the really close parts of your small intestine, that produces bright red blood that you vomit. Bright red blood in vomitus is not a good thing and typically requires you to be checked very quickly. If you produce blood in your stomach and the proximal part of your small intestine, if you don't vomit it, it begins to be processed through your intestine and it turns very black. And if there's enough of it, it produces a tarry like appearance. And that indicates typically something that has irritated your small intestine and stomach to the point where you're bleeding. So that's ulcers or infections. And it produces a tarry black stool that's stinky. It's very stinky. And it's typically not something that you can miss. The further you go down into your GI tract and produce blood, the more likely is that it's going to be a dark red color. And infections from E. coli, from Listeria, from Salmonella, produce dark red stools that are again stinky, but stinky in a different way. If that happens, that's an emergency department visit. We have to test and find out what is causing that, and then do what we can to provide early treatment for it, which usually means treating the infection. There are some of these that progress and begin to irritate your liver and irritate your kidneys. That's a further problem with those kind of profound food poisonings with names like Listeria, Salmonella, and E. coli. Finally, if you have blood that is coming from the lowest part of your colon, which is around your rectum, that is bright red blood. It can come in almost everybody at some point in their life from irritation around the opening. It is bright red. It's a small quantity. That's not an emergency. It's going to clear on its own, and you're going to get better. We have to have these gross discussions every once in a while because people don't want to go and seek care unnecessarily. Food poisoning is different than viral illness like a norovirus. Norovirus, your GI tract wants it out, and so it moves very quickly to have you both expel it by vomiting it and have loose, watery diarrhea, frankly, that isn't very stinky. You're rid of it, typically in about 12 hours. You're taking some fluids. In about 24 hours, you still feel puny, but you're back on your feet, not having any diarrhea. That has nothing to do with blood coming from anywhere, and you go on about your way. In treating these, just so you know, it's always about taking it easy on your stomach and your colon, and that's giving it simple substances like water and a few salts and a little sugar, and some simple starches, and then proteins, and then fats, kind of in that order. So that's the way to approach it. In little children, we have to be really careful giving them fluids. So we start little bits at a time. And for infants who get vomiting and diarrhea, we may even be down to using like tablespoons or syringes full of fluids at a time. So that's typically Pedialyte or a similar, and you give them a syringe full about every 5 minutes, and see if they'll keep it down. And typically, if you go 30 to 45 minutes and they haven't vomited, you can increase it a little bit, but that's how we replenish little children who've had vomiting and diarrhea who need to get their fluids back up. And we don't like to start IVs on those little children, so we don't do that. So today is the gross day, talking about GI stuff, but important that you understand how to manage that at home. And as one of our readers wanted to know what the difference is between a infection in the GI tract and food poisoning. And then the recommendations on COVID, please keep yourself safe. By the end of this month, in our next Doc Talk, it's going to be near October, which is Fire Prevention Month. We're going to talk about fire prevention, about burn care, etc. And at that point, we're going to be able to focus on what's coming ahead in the winter. I want you all to stay safe, have a great month, and I look forward to the next Doc Talk. Take care, everyone.